I did not always have great teeth. And then when I was diagnosed with cancer in 2018, I had head and neck cancer. I watched several podcasts. That was part of my research, was listening, learning. If you don't think you can get it done or you're not sure, come and talk to them and see how it is here, how it feels.
What changes now? What is the new Laurie going to be all about?
Both my grandparents were taken from cancer. My mom's dad, he had worn dentures for a very long time, and I just finished dentistry, and he passed away, and I was gonna do implants for him to have teeth. So yeah.
It is the physical. It's the being able to smile. I'm getting ready to go on a cruise. I'm looking super excited about going on the cruise and smiling for those pictures. It is the community. It is the group. Supremedental is amazing. He was there when they told me no, that it couldn't be done. And then he was there to support me the whole way. And we got it done.
We got it done.
We got it done.
Welcome back to Supremedental Podcast Studio. You can be anywhere else in the world right now, but you're here with us, and we appreciate that. Don't forget to like and subscribe. Remember, this podcast was meant for you, our patients. My wife and I are the owners of Supreme Dental Clinic. Don't forget to listen to us. Really listen to us, because we're also on Spotify. So you can go ahead and go ahead and type in Supreme Dental Podcast, and automatically will populate right there. Today comes a day that we've been waiting for quite some time. Today we have Laurie here, and we have Dr. Elias here. Tell me, this is probably gonna be an emotional podcast, just to let you guys know. So if you guys have a box of Kleenex, bring it in, because you're probably gonna need it, because I did. So tell me a little bit about who you are. Tell me how everything got started. Tell me.
So my name is Laurie. I'm from Texas, and I did not always have great teeth. And then when I was diagnosed with cancer in 2018, I had head and neck cancer and ended up receiving a large amount of radiation, 70 rounds of radiation. And that compounded the problems that I had with my teeth, and was told that basically there was nothing that I could do about it. Part of the other problem that impacted it, which I don't think I mentioned before, was it was almost time for COVID. So dentists closed down. Didn't have a lot of that, so that compounded my problem, and my teeth began to get worse and worse, and I didn't have salivary glands anymore due to the radiation. The decay really set in, bone loss, of course, sets in with all that. And so I finished up everything with my oncologist, and I talked to him about my teeth, and everything was always, you're stuck with it. This is what you have. There's nothing you can do. It's a high risk and all those type of things. And so as I met as my years passed and I reached that 5-year mark, which is a very important 5-year mark for cancer patients, I went back to him and talked to him again, and he said no. And I said, we can't just say no. I have to be able to do something.
Right.
So we started risk analysis and started looking at different things. And then I was sent to 2 other dentists. I actually went to 3. And the amount of what they wanted to do to tackle it was huge. There's no way that I could have ever done it. I couldn't have afforded it. Well, I guess I could have, but then I could never retire. So
selling your house was an option?
Well, and my husband and my car and everything
This is
else.
true.
I mean,
Yeah.
you know, it's, and even though, you know, you have insurance, they look at that as cosmetic, even though cancer is the biggest thing that took it. They look at that as cosmetic, and they said, well, we can do what we can, and we'll just give you slip-in dentures.
Makes no sense.
It makes no sense. So I started trying to figure out what I could do, did my risk analysis, and I found a place called Dental Departures. And this was one of the places that was recommended. And so I started doing my research. And I looked at y'all a lot before I ever even came through the door. And then first time I met with Joel. And Joel was like, you know, we have a specialist. And that was you. And I met with you twice before that. And then we began the journey.
A little bit on that. He was on vacation.
That's what he told me.
And he was on vacation, and he was supposed to come back to the next Monday. And on Thursday, I think we send you the Xrays, and you say, or Wednesday, you said, I'm flying in Thursday night. I can be there Friday morning to take a look at this case. And I remember him looking at the case and telling me, this is going to take everything that I know so far and just put it in one.
Yeah.
Tell me a little bit about that.
Well, with the background with cancer and everything, and looking at the CT scan, her bone wasn't too dense, right? So we were looking at palatal approach. There was one implant that gave me a lot of fits. We were talking about that.
Yeah.
But with palatal approach and all these techniques, the pterygoid implants also helped out to get the amount of torque to be able to put teeth right away. Because we didn't want to extract her teeth and have her go home with dentures. We wanted to place teeth right away. So we were able to do that. It was a tough case, but we got it done. It's very important. It's 50% us, 50% the patients. Yes. So her background as a nurse, and she was very committed. I mean, she was here after all her appointments. Her mouth is very clean. So yeah, we all played our part, and we get great results.
Welcome to Dental Facts. Did you know coconuts are a natural antibacterial food and can help reduce the risk of developing gum disease and cavities? You heard it first at Supremedental Podcast. Floss, brush, and keep smiling.
I want to post, George is going to post 2 different Xrays. We're going to post the Xrays of before, and we're going to put the Xrays of after of the implants when they were placed. And it's crazy.
Yeah, we have the before, the after the surgery, and the one we just took today.
Okay, so then we'll post 3. 1, 2, 3 imaginary ones that are going to be in the pocket. Now tell me, I've heard you told me in the waiting room after your first visit, after you got the work done, I was speaking to another patient there, and then I seen you sitting down, and I knew who you were because he had told me, and because I have heard about your case. And you told me that you had seen the podcast before.
I watched several podcasts. That was part of my research, was listening, learning. I did it for months. You know, the whole time I was doing my risk analysis over there and seeing what they said over there, to see what somebody said over here, to watching the podcast, to everything from what patients were saying to what the dentists were saying, just to try to get a feel for the whole thing, using that nursing background to, what am I seeing as a patient? What am I seeing as a healthcare person? And trying to mesh it all together to see, because I told him I was worried. I mean, I was very, very worried. I knew it was going to be a tough case. I knew I had to do my part. I just had to do everything right and not put myself at a higher risk than I already was.
You seen her podcast. You did your research. When you came in and after you spoke to Dr. Elias, what made you want to take on this journey with us? Besides of what you had done already. What made you say, this is it?
I felt confident with him. The things he was talking about, the things that he was discussing. We went over my CT. He told me, it wasn't just oh yeah, we got this, we can do it. It's okay, this is what we have here, this is what we have here. I need to look at this. And so, like I said, that nurse side of me is listening, and the patient side of me, I didn't want to just go into anything blindly and, put myself at a higher risk of what could happen behind the complications. I already knew that because I did that research too. But, he explained it from top to bottom and admitted that it was going to be a tough case and was still willing to take that on and go into that with me.
You walked out of here with immediate loads, correct?
I did.
I remember after the surgery, it was a big surgery. And I remember I told you, like, it doesn't, I don't know if there was a little bit of swelling, but it didn't look like for what you got done. Because you had, how many implants?
12.
12 implants. And you were sitting in the waiting room like if you hadn't even gotten done, you were waiting to get in.
I felt great. I would hear people say, oh, I don't have any pain and I don't have any pain. And I would think, oh, I wonder who told them to say that.
I was right there like.
I didn't have any pain. I truly had no pain in my friends that were with me, because I was thinking, okay, it's this big surgery. I got to get back across the border. Am I going to be all loopy? And I didn't. I felt great. My friends kept saying, we're supposed to be helping you. And I'm like, man, I got this. Just make sure that I can, and they drove me so that I didn't, but no, I felt fine. But then I did have a little mishap not long after.
Tell me about that.
So let's see, I had it on a Tuesday. And on Saturday, I began to not feel well. And I just put it as, I put it as the anti-inflammatories that I was on. And I thought, well, it's just got my stomach upset. Didn't think anything about it. Sunday, Monday, Tuesday rolls around. I really just don't feel great. And I still thought I had a stomach bug. And on Thursday, I asked another nurse to take me to the ER, which is very uncommon for me. Mm-hmm. And turns out I had to have emergency gallbladder surgery. And the whole time that I'm inside of the ER, I'm thinking, I'm not having any pain here. I'm not having any fever. I don't think it's this, but I can't figure out what's going on. But I just had this big major surgery.
Wow.
And lots of vomiting, which we worried about with the sutures. Yes. And every time I was that nurse part, I'd go in there with that water and I would rinse out. And then I would
throw up like a... So you'd block the gums?
Yeah.
Doing whatever I could. And totally unrelated to my teeth and the surgery. I had emergency surgery here and got through that and fine. And it didn't stop anything. But when I came back to Dr. Eli, I went, I need to tell you, and I know that worried you.
Yeah, of course. Yeah.
Yeah.
The acid on the implants and the stitches, the wounds and everything. It was a complicated surgery.
Yeah.
So, yeah. It added a little bit more spice.
A little bit more salt and pepper to the big case that was going on already.
Yes.
That's awesome. Tell me, we were just before the podcast, we were speaking, all of us here, and I wanted to save it for the podcast as much as possible. But your husband, who's sitting down over there looking at me, he said something about, and you had mentioned something about what it was like to be in the waiting room, what it was like to be at Supreme. Tell me a little bit about that for patients that, believe it or not, there's still a lot of patients out there that online, they send us messages and they believe that we're fake because we're not able to do the things that we do in the time that we do it. And I mean, you look real to me. So
I'm pretty real.
Tell me about that.
So the first time I came is when I saw Joel, and I went to the clinic. Supremedental. Yes. So I went to there first, and then, of course, walked in. That's where I first met Manny.
Okay.
And Manny remembered me from that day forward. I would walk in, it's like, hey, Laurie. And I'm thinking, how do you know who I am?
Yeah.
You know?
Okay. Yeah, he's really good with names.
He is
Yeah.
really, really good about that. And anyway, so that was the first time. And then I came back, I don't remember, probably a few days later. And in fact, there was another patient in the waiting room, and he kept telling Manny, you need to take her over to that other side. It looks amazing over there. It's crazy. You got to go. And I'm just thinking, okay, what's up with this little guy, And, but the second time I did go over, and that was on that bigger clinic.
Supremedental Cosmetic Center across the street.
Yeah. And that was where I met Dr. Eli, both the second 2 times before we did the surgery. It's bright, it's white, it's super clean. It's just not sterile feeling like you would think of with, hey, what's your name, and give me your money and have a seat. It's
Personalized.
It is. I mentioned it's like a community. It really is. You don't just feel like a number. You don't just feel like the next patient that's coming down the line. It's, from, hey, it's good to see you again. How are you? The different people coming in and out. You're not going to go to somewhere typically and your dentist or your receptionist are coming through the waiting room and talking to you, or the owner, like you, whenever we sat there that day talking.
Yeah.
It doesn't typically happen. It's not that cold feeling. It's very much a community feeling that we're all on a mission and we're all going to get it accomplished together.
And it's so hard when we add someone to this team. Like right now, we're going through this right now. And the crazy part is that not a lot of people apply. And we were just talking about that this morning because of these guys. They keep on posting these crazy, amazing Xrays. And dentists said, I'm not ready. I'm not ready to be in that team. So they scare all the dentists away, which is, it's a good thing. But then we don't have much to
then
be
you
able
can't
to
go on
get.
vacation.
Exactly. I'm like,
Yeah.
you're pretty much stuck here forever. And it has to do a lot with attitudes also. We have gotten people with, I'm going back, I think she was a specialist or she had a master's degree. I think it was a little before you came in. Within a week, she was gone. Because I couldn't have her in my team because it don't matter how much she knew or that title said she knew, because a lot of times there's a lot more than just a title. But it was just her way of being. And I can't destroy what we got because everybody is happy to be working. And they work long hours. Like he works, I got to tell him to go home. I'm like, you can't stay here, Elias. I'm going to start charging you like if it's a hotel, because him and Luis and Alonzo, but it's normally him and Luis don't want to leave. It's like, oh yeah, no problem. I seen the cameras one time, Luis. It was 5 a.m. 5 a.m, and I get an alert. Well, I've been getting alerts, but I was asleep. And I look, and I'm thinking, oh, the camera just froze. Restart it? No. And I call, and one of the assistants answers, what are you guys doing? Well, Frank, we have this patient that wants to leave tomorrow, so the things weren't right, so we decided to pull an all-nighter. And I'm like, who authorized that? I mean, I'm happy you guys did it, but I would have never approved it because you guys got to sleep. They're like, oh, no, but we want everything to be perfect. And I was like, it was mind-boggling for me because I was like, who does that? Everybody normally says 4 o'clock, 5 o'clock, I'm out. I'll see you later. These guys keep on messaging. They keep on going over cases. He was one of the main persons that helped us design an implant. And it was 5, 6 o'clock in the morning on Sundays. And I'll be sending messages all the way to Israel to design one of the implants, which you have 2 of them, the 2 pterygoid implants that we designed in your mouth. So because of things like that, of those designs, we were able to give you something permanent, a lot more sturdy. Now tell me, I was going to go back, but I missed that spot, that Manny is really good with names.
Manny is excellent.
He's amazing with names. There's 2 things he's really good at: names and eating Reese's. Like that's his weakness. Like he would eat Reese's.
Wish I'd known I'd have brought him a bag.
Yeah. He's all about it. It's great. He's like, these Reese's come from this part of the world. These Reese's come from them. I'm like, oh man, you're going international. I mean, it was pretty crazy. But Tell me about the technology, because we used the pig dental on you. Tell me about it's not something it's something that's used worldwide, but not a lot of dentists want to invest in this technology. Now that you got your final work, which was like an hour ago,
Yeah.
you see how that sat perfectly? He didn't have to do crazy drilling in different parts to weaken it. It just pretty much sat like it should. Everything distributed. He's super picky. He sent it back. That'd be a whole nother podcast because he's super picky.
I appreciate his super picky.
Yeah, he's super picky, and Luis is super picky too. And Alonso, I mean, we make this because we know that what we're doing, a lot of our patients, I mean, obviously you guys are spending money, but a lot of the patients have done so much to be here. We want to give you the best possible, and we expect the same from everybody that we work with, being the lab, being whatever it is. So we had a meeting yesterday with the owners of the lab.
We did. Yeah.
Me and you and the owner and the designer, which is a really happy talk that we had because we wanted things to be perfect. And the owner of the lab happened to pull an all-nighter to be able to have that smile you have right now.
I wondered.
Because he... yeah.
I did. Because he was actually in there with us. And, Dr. Elias was showing him and talking. And I'm thinking, how are they going to be able to get this thing done? But they did. And
it's amazing. And when he came in, before we put you in, I had looked at him already. And I was walking in, and I passed right next to Dr. Elias, and he's like, how are they? And I go, you're not going to like them, man. And I kept on walking, and he's like, and he goes after me, and I'm like, I'm just kidding, man. I haven't even seen him yet. But
Sure.
But we want to make it as fun as possible. So obviously we know medical is very serious, and when it's the medical portion of it, we take it very serious. But we also want to have fun. We also want to record videos. We also want people to know that we're human, not just boop boop boop, just robots. Not like you said, a number. We customize things for everyone to feel. It's a family. You just joined the Supreme family. So you will forever be remembered with this podcast and in our minds because it was a very difficult case. And after you've seen that all the implants were perfectly placed, not perfectly placed because we knew about that, but there came when you came back and we had to torque them. And that was like the decisive part.
Yeah.
Because we had to torque each and every one to make sure that they were fully integrated. The Xrays, the CAT scan that we used, 9600 Carestream, let us know that they were, but we still got to take a look at it. What was going through your mind when that was going on?
well, the moment that I was able to talk, because, and I'm like, how are they? How are they? I mean, I was worried too. But, I was constantly, okay, am I having pain? Am I having it? And I didn't, but I worried right along Dr. Elias because, I was worried. I knew that I was a complicated case. And then I had to complicate it even more with the gallbladder, like you said, add a little extra spice. But I felt like Dr. Elias had me. I had done everything that I could do to do my part. And I feel like he went above and beyond to do his. And, the equipment was good. We got it done.
We got it done.
What was your reaction? I know your reaction. But what was your reaction the moment that we knew all the implants were good?
I had little tears running down my eyes. I did. I was laying there with my mouth open and I had little tears running down both sides. So, because I knew that I had done the next hurdle, that I was getting there, that everything was going good. So.
Yeah, I remember Dr. Elias got pretty teary-eyed.
Oh, yeah, of course. I had to.
What did she say? What did you say that made him get teary-eyed? Do you remember?
You remember.
I remember.
What did I say?
It was something to do with a curse word.
Yeah, it was.
Oh, you know what it was. She just didn't want to say it. She's like, no, you're going to say it. I'm not going to say it.
Yeah. Well, I just did the universal cancer.
Yeah. And you got teary-eyed because of?
Both my grandparents were taken from cancer. My mom's dad, he had worn dentures for a very long time, and I just finished dentistry, and he passed away, and I was gonna do implants for him to have teeth. So yeah.
I'll take a little spirit of that, of your grandfather.
Oh, thank you.
Yeah, definitely.
I told you it was gonna get emotional.
I know.
I told you it was gonna get emotional. Ooh, what's going on? Is there something in the air? What's going on right now? Is there smoke? George, do something. Let me know now. What do you think? Were you expecting this outcome in your mouth? Were you expecting? 'Cause they look beautiful.
Yeah.
Were you obviously you're gonna recuperate that muscle memory after 2-3 weeks. Everything's gonna start feeling better. But were you expecting this outcome in your mind? Did you say this is gonna happen? Like it's gonna be this good, or I just hope it works and I can eat.
I was hoping. You know, when you sometimes it's not always just eating.
Right.
It's talking, when you're presenting yourself to somebody, when you're smiling for a picture, and you're thinking, okay, do I have to set one way or the other? Do I smile with teeth or with no teeth? And, just that simple part of eating, I can't tell you the last time I've had a hamburger or even a sandwich because I couldn't bite because I had lost most of these or they were just barely sitting there. So it's everything, how you present yourself, how you can smile, how you can laugh. It was kind of funny because I had in my temporaries, I found out that I'm a tooth grinder. Didn't know that I was, and I actually broke one and I popped it out. And so when it was out, my little grandson looked at me. And he'd lost his first tooth, and he was like, "Oh, look, Lolly, we look the same."
There you go.
So for him that was kind of fun, but for me that's not how I wanted to,
Right.
look or smile or constantly with my mouth closed, or if it was open, that's the first thing that my eye would go to was like, oh, it looks terrible, it looks awful. So, and to eat.
Lupita's shrimp tacos.
Yes.
So besides eating now, then you're gonna be able to eat whatever you want to eat. Well, whatever. I mean, she can't eat certain things, but
I know.
Rocks.
He'll tell me.
rocks. You can't eat rocks.
Can't eat rocks.
Yeah, they're good, but it won't work.
Yeah.
But
Yeah.
how does this, from this point on, this is a brand new Laurie.
Mm-hmm.
What changes now? What is the new Laurie going to be all about?
When we talk about having cancer, it takes a lot from people.
Yeah.
It's physically, it's mental, it's just kind of a lot. And, and like, it's almost like every time you would, either smile or eat or whatever, it was always just, it's still affecting me. But maybe I can look at it. I mean, once you've had cancer, it never goes. It's still there. But this is a part that I've been able to move on from it. That I can say, you took something, but by God, we took it back. So, it is the physical. It's the being able to smile. I'm getting ready to go on a cruise. I'm looking super excited about going on the cruise and smiling for those pictures, and eating that food. But it's almost laying a piece of that cancer aside to say, you know what? Not only did I beat you at it, but I beat this part of it too. And that's kind of the way that I look at it.
That's I think the lights are really affecting my eyes right now. It's this lighting. We got to change the lights, George. Remember that. Write it down. Now, Dr. Elias, I know that you obviously went to dental school to be able to change lives, but you giving people their smile back a lot of times gives them back a big portion of their life. How does that make you feel?
I never realized that when I was in dental school. Honestly, I think no one does until you're actually here and you see the process, and you're able to perform on a platform that you present us on. It's crazy. You know, I talk to my mom when I drive here to work, and I'm always telling her about the cases, and she's been my patient. She's been here, and she's like, she's very proud. And like we were talking about that you get caught up in work that I don't realize sometimes the way we impact people's lives until you show them. Like today I had another surgery that I want you to meet. We did the surgery on Monday. We tried on the temporary teeth, and she started crying, and I was like, oh no, she didn't like them, you know.
Yeah.
and she's like, I'm super happy. I've never seen myself smile like this before, and it's just the temporaries. And I told her, just wait till the real ones.
Yeah,
just wait till the real ones. So you never realize that until you're actually talking to the patient, and you listen to them, and then it starts like setting into the life-changing dentistry. It's crazy. It's crazy. It is
crazy. You know, that's, you know, we always say that one of the first things that you notice about somebody is, you know, is their smile, you know. And so if I come up and I'm like, hey Frank, how are you? Are you doing okay? And, you know, and I'm like this the whole time. But if I can just say, hey Frank, how you doing today?
Makes a world of a difference.
It does make a world difference, you know. And it's not only what you present out to other people, it's being able to look in that mirror and look at you and be happy with what you have. And that's what he gave me.
Well, thank you.
That's what he gave me.
That's awesome.
It really is.
It's
I'm blessed. Honestly, I'm blessed. I'm blessed to be here. I'm blessed that people actually trust me, that you trust me, that the patients trust me to do this. And you know, I get to go home after the surgery, and I'm always thinking about this, that, and the. It's like we never turn it off, you know. And with Doctor, you saw with Dr. Quintero, with Dr. Luis, we're always talking about cases. Like, remember this, remember that, and we're always, and Dr. Alonso as well. Everybody, we're always, hey, take a look. What do you think? What do you think? And it's always there. It's like it never stops. It never stops.
Yeah, it goes back to that community of, you know, you can go to one place and you just deal with one dentist and that's it, but when you come into here, I don't know how many times I would see, you know, Dr. Quintero or somebody in there, and y'all talking and y'all looking, and, you know, it was that team effort.
Yeah.
You know, it's not just, oh, I got this. You know, I don't care what anybody else saying because I'm just doing my thing. It's that community, you know, to get it done. Or, you know, you're walking by and, you know, I remember when I got my temps and I saw Manny and he goes, you look amazing. And they were just my temporaries. But, you know, it is the community. It is the group. Supreme Dental is amazing.
Thank you. It makes a world of a difference. Obviously, we're here because of our patients, plain and simple. There's been so many times when I rolled up on a Monday morning and then I said, I need to talk to you and Luis. And then we sit down and I said, I want to be able to do this. Or how can we do this? And then they start thinking. Or I go on, we went to Dubai to take a look at, we went to the biggest dental expo conference in the world. And I came back, but before I left, I left them a homework. I said, hey, I want to be able to do this. Let me know the medical part of it. And they had homework to do. And when they came back, we all sat down, all three of us, and we came up with exactly what can be done, with what materials it can be done. And now we have to go to the lab portion and talk to the lab and make sure that we're able to give you guys the best option possible. If there's something out there that we need to purchase or we need trainings on, we're going to be there. These guys are going to Singapore. Then they're going to go to Mykonos, Greece. And we might be New York at the end of the year. And we might be in Vegas in the beginning of the year. And I don't know what else is going to happen. Like it's with Egypt, I don't know. Wherever we need to go, we're going to be there. And whatever needs to be purchased, we're going to buy it because we want that smile. So
I think something that I look at again, as a healthcare person, is that mutual respect. You know, he talked about the platform that you provide them to do that. And then you say, I'm not a dentist. Tell me what we need on the medical side. And, you know, all in all, it's a business. And I mean, you're in it to make money, to pay your bills, to raise your kids. And I get it. But you have created a place that is not just about, I'm here to pay my dollar. It's, I paid it, but I get so much beyond that. So I think there's a lot of respect between y'all. And I think you look at it as more than just the place that you're getting your money to pay your bills. I think you look at it as a place that helps people feel better, that makes us look better, makes us feel good about ourselves, that, you know, the work that they can do. And it's a very cohesive place to me.
My wife and I have worked so hard to get, I mean, we started this in early 2008 when we were 21. And I've always told these guys that I told them that this is a dental business, a medical business. But when the business takes over the medical, it just becomes a business. And we can never allow that. So these guys let us know our limits. They let us know what they want or what they've seen. And then we got to make it happen on our portion of it. But we got to make sure that the patient, I told them, you could be the best dentist in the world, but if nobody knows about you, how are they going to come? How are you going to change their lives? That's when my wife and I go in and show the world what they can do. Show the world what we can do. Show the world how we can change people's lives. And it's a perfect team. I'm never going to be in someone's mouth because that's not my strength.
Right.
But that's their strength. So we believe it in, like in any team, if you let someone work their strengths, they could become unstoppable.
Absolutely.
So right before we leave, look in the camera and let patients let them know if they're going through something. Let them know why Supreme.
I don't know that I have enough time. It's the confidence, it's the feeling of community, it's the feeling like it's a good decision, the beginning, the middle, the end. Just, if you don't think you can get it done or you're not sure, come and talk to them and see how it is here, how it feels, and just come on down.
There you go. Couldn't say it better. No, George had an idea. If we want to tell your husband to come in, would you like to come in over here?
So what I'll say about him is that he has been with me on this struggle. You know, cancer is not only hard on the patient, it's hard on the family.
Yeah.
And he has watched me struggle. He was there when they told me no, that it couldn't be done. And then he was there to support me the whole way. You know, both physically, mentally, and then coming here. So he's been by my side, and I know that it means a lot. You know, it's true that it's in my mouth. I mean, it's my teeth, but it's something for him too. It really is. And like I said, you know, when we've come in, he's made the comment about, I couldn't ask for any better care, the way that y'all act, the way that you are, just that feeling very, very personal. So y'all not only have helped the patient, but it's the family too. It really is. It's all encompassing.
And now he's with you with all the new smiling you're going to have.
Yep.
So now you guys are going to go on a cruise.
Yeah, we're going to Alaska at the end of May.
There you go. There's going to be a lot of eating, a lot of smiling.
A lot of smiling. Yes.
There you go. Well, thank you so much for being here today. We will fix the problem with the lights. I think it's affecting people's eyes. And thank you so much for giving us the opportunity to be able to make this happen. and make us part of your dental journey. Whew, it's pretty crazy.
I know.
But thank you so much, and obviously thank you so much. I don't know if you ever done a podcast before.
I have not.
You're smiling now. This is a new Laurie.
That's right.
She's gonna be in a podcast. You're gonna be on YouTube. So you can tell your grandson now you're a YouTuber.
Yeah. Yeah.
There you
Oh,
go.
they'll be excited. They'll think
You're
that's really
YouTube-
cool.
You let them know you're YouTube famous.
Yeah. YouTube famous. I'll be looking forward to seeing it.
There you go. Well, thank you so much for being here. Thank you so much for being here also. Dr. Elias, you keep on doing what you're doing.
Thank you.
And this has been Supreme Dental Podcast Studio, powered by Supreme Dental. And just like Laurie, keep on smiling.